Hi, everyone. Dr. Nemechek here. I want to go over just a common mistake seems to happen out there quite a bit, and it's about kids being diagnosed with strep throat. Now, it's a very real thing. Some kids do have it frequently, but I don't think nearly as much as some people believe, and it's because the diagnosis isn't made right. Okay, so I just want to go over this, and you might have to scribble some notes to keep this so you can refer to it. But so, streptococcal pharyngitis or strep throat. Okay, so you need to have red and painful throat in the back. Okay, you can have pus on the tonsils or not. Doesn't matter. Those don't help with the diagnosis. Okay, because viruses can cause pus on your tonsils. All right. So red, painful throat, fever. But this is the important part. No prominent cough and no diarrhea. If your kid's coughing a lot, you never do a strep test. Strep throat does not cause a cough. All right? It does not cause a cough. So you have red, painful throat, fever, no cough, and no diarrhea. So if you have a cough, you actually probably have postnasal drainage that's making your throat red and painful. From a sinus infection, that's a different thing. You don't necessarily need to use antibiotics for that. And two, if you have diarrhea, that's most likely a virus. Its antibiotics won't help you at all. Okay? Now, so you go in and you should, so red, painful throat, fever, no cough, no diarrhea. Then you do a swab. If it's positive, you treat with antibiotics. If it's negative, you don't treat with antibiotics, like just in case, okay? You have to send a swab to a culture and see if it grows. If it does, then they'll know like within a day, then you would get antibiotics, all right? Now, here's kind of where some more of the problems occur. So, as I mentioned, people comes in, red, painful throat, no pus, with or without pus, doesn't matter, fever, but they have this cough or diarrhea. As I just said, you do not treat. You do not even do the strep test. Okay? You do not treat that with antibiotics for strep throat. All right? And the reason why you don't even do the swab is that in America, it's, about 12 to 14% of children in America are carriers for strep. Now, this is a harmless strain of strep that they have, causes no symptoms whatsoever. If you're totally healthy and you do a swab, it's positive in these kids. All right? So if you have a viral infection or a sinus infection that's making you cough or whatever, and you do a swab, it'll be positive. But you don't have strep throat. It's not contributing at all to your symptoms. All right? So you got to watch out for these positive streps. And I hear this quite frequently. Parents come in, it's like every time we go in, he's got strep throat. And I'll say, is he coughing a lot? Oh, it's just horrible. Cough, 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 cough. These kids are carriers. Really, all they need is some Flonase to take care of the sinus drainage and infection. They don't need antibiotics. But some providers they just don't understand what they're doing. So, and these kids are getting exposed to a bunch of antibiotics needlessly. So, again, fever, painful red throat, no cough, no diarrhea. Think strep. If they have cough or diarrhea, they got something else. Okay? And you got to watch out for these if your kid's a carrier. It's a lot. It's like 1 out of 7 or 1 out of 8 kids. That's a lot. All right. That's all for today. Everybody, take care. Bye.